Let's see. A patient comes and he tells you that whenever I lie down, my cough increases. Right? How to proceed from there? How to proceed from there? There are many remedies whose cough would increase by lying down. But Drosera would be as soon as he keeps his head on the pillow, he will start coughing. And the cough would not be like just a normal dry cough. It would be a suffocating cough, spasmodic cough, almost croupy, right? Now let's understand rest of the remedies who would be, aggravated by cough. See here, patient lies down, but when the patient lies down, because he starts getting suffocated, he gets up and sits up. Now, this patient of Croton Tig, he has fear of lying down. I want all of you to listen to these differentiations very carefully. What I'm sharing is all my personal experience from my small cases. And it's very interesting. How would you differentiate? Now, every symptom's intensity will change from remedy to remedy. And this only can be differentiated by very acute observation and very refined questioning. Otherwise, you will not be able to give the correct remedy. If you miss this, that in a Croton Tig patient, the main peculiarity is of being suffocated. Let me show you. Phatak has beautifully written this. No, this is repertory. Where is Phatak material? I think it must be above. Yeah. So what is a Croton Tig? Otherwise, it's a gastric remedy. The cough of Croton Tig is of gastric origin. Now see what is written here. How to increase the font. Zoom in. Okay. So see what is written here. I want all of you to read this. Again, same symptom of Drosera. But there is a difference. Because there is a problem with inhalation. The patient feels that he cannot expand his lungs. Croton Tig, if you know the sensation is of hide bound, very tightly bound. Patient wants, especially, he cannot tolerate clothing on the chest, especially. Isn't it interesting? Yes, cannot expand the chest. So if a patient comes to you in a status asthmaticus, this is how you would differentiate between the Croton Tig and Drosera. And of course, the abdominal symptoms. Some or other abdominal symptom might be present there, maybe in the past history or what. The cough of Croton Tig is of gastric origin. Let me see if I can. Where is Boric? See, drawing pain through the chest into the back, especially in asthma. This patient will tell you that the pain is going through the left chest into the back, and he cannot expand his chest. Especially if I refer to you, women. What will women refer to you? That they cannot tolerate their brazier. And again, as soon as head touches the pillow, cannot inhale, cannot inhale. The inability to inhale and this chest thing is what differentiates. I'm going slow because I want all of you to understand the differentiation. So far, clear? Yes, Kiranjot, you're right. So now, next thing is there is aggravation on lying, but when does this aggravation comes? When a person is lying in one position for a long time. So coccus cacti or acid falls, both of them will have to change their position from time to time. And see how detailed our repertoire is. See this third symptom. Lying aggravate, only when lying down aggravate. Otherwise, there is no cough. And the patient is forced to sit up, cough it out, and then head rest. Many patients will come to you and say, Doctor, whenever I lie down, the cough starts. I'm okay all day. There is no cough all day. I'm sitting, no cough, walking, no cough, standing, no cough. The moment I lie down, doctor, I have to get up and clear the phlegm out, and then I can go to sleep. That's conium. Very similar to conium is mag sulf. Sitting will not give relief. He will have to stand up. It's the next step that he has to take. Magnesium sulf has to stand. Then the cough gets better. And again, there are there are different characters of cough, right? Now this we are talking about convulsive and spasmodic cough, where the air pathways have gone into the spasm, and the patient, you when you see this patient coughing, it's like almost he is starting to have convulsions because the cough is so severe. The severity of cough in this symptom, convulsive spasmodic, is different. So you will see there are many remedies: conium, pulse, Rumex, sanguinaria, coccus cacti, hyo, Aurelia, nephitis. But you know, it's every remedy is different. Now you see that the patient is having spasmodic cough and it is aggravated by lying down. These are the set of remedies. So we are talking about acute cases here, mastering acute symptoms. Conium, you see there, we have we have already discussed conium, and it is especially in old people. And conium will have perspiration in the night. Pulsatilla will need to have a half reclined position, and desire for open air, and desire for company. Rumex, very interestingly, amazing results I have had with Rumex. When one symptoms, one symptom comes is that patient wants a candy in the mouth. In India, we have this mishri, that sweet sugar. Patient keeps it in the mouth to keep the cough stopped from coming. If this patient is telling you, you confirm 2 times, there is no condition that Rumex will not work. It always works. Sanguinaria, see the last symptom written is of sanguinaria. How interesting it is. Now in sanguinaria, the cough is dry, convulsive, exhausting, especially in children. And again, sanguinaria's cough is of gastric origin. And especially if you will observe the child, while the child is coughing, if you will listen carefully, the child will be farting along with, will be passing flatus along with the cough. And whenever the abdomen contracts for the cough, a small amount of flatus will pass. Sometimes mother might tell you in a funny way, डॉक्टर खांस भी रहा है और पाद भी रहा है, दोनों इकट्ठे कर रहे हैं. But there is a connection between the uh, gastric symptoms and respiratory symptoms of sanguinaria. Let's read sanguinaria. It's very interesting. These are not very easily given remedies in cough. Let's see what Borik writes. Cough of gastric origin, relieved by eructation and flatus also, both. Spasmodic cough after influenza, after whooping cough. Tickling behind the sternum. Interesting. Severe dyspnea and constriction of chest. So that's sanguinaria. Rheumix, candy, they need something sweet in their mouth because there is extreme dryness. They need to keep their throat wet, and that can happen by taking something sweet. It's not only mishri, something sweet, strepsils, maybe anything, but they will keep the throat from becoming dry. Coccus cacti, again, spasmodic cough that comes on lying down. So after this session, you will become specialist in cough that comes after lying down. If any other patient comes to you, you say sorry to them. You tell them we can only treat cough if it comes to you after lying down. Otherwise, you can find another homeopath. I'm joking. Please don't take it seriously. One by one, we can do it. Let's just how to different from here. But in coccus cacti, the cough will be very violent. The violence of cough is kind of maximum compared to all other remedies. It is again a remedy that is both mixture of insect and plant, like Drosera. But the coccus cacti cough is especially in the morning, especially when the child is brushing, the cough comes. Such interestingly, the symptoms are written. And it's almost as if patient will go into convulsions. And very interestingly, what will happen in hyosemus cough is that patient will lie down, the cough will start. Patient will get up and sit, the cough will stop. The patient will lie down again and the cough will start again. And will sit up again and the cough will go away. This is a hallmark of hyo. If patient is telling you this symptom, there is no option that hyosemus will not work. What happens in Aurelia? Very interesting remedy. It's Dr. Sarkar's favorite remedy. So patient lie down, goes to sleep. Patient is sleeping, goes in the deep sleep. And when the patient goes in the deep sleep, that is the time when the cough will start. So see how interesting it is. You have to ask these leading questions in case of cough, acute cough to the patient. When does the cough starts? Is it in the day or the night? Is it just starting just as you lie down, or is it not letting you sleep, or the cough is coming after you go to the sleep? So these kinds of questioning will lead you to the remedy of cough.